Wales. Yeah, I very much like the last presentation from Hauke. I like the idea of encouraging people to give more. I like the idea of showing people very simply what they can do per pound. But I think, perhaps as a note of caution, the very nature of a lot of neglected tropical diseases, some of them certainly, such as leprosy, are becoming more rare. And when you talk of mass drug administration, they're quite costly interventions. So perhaps if you take guinea worm, for example, the costs for finding the last cases of guinea worm are huge. But of course, total eradication is within our grasp, so it's well worth doing. So in a sense, that's not yet addressed by what you're doing. And also, even when we talk about water and sanitation, it's been mentioned in other forums that a lot of the work that's been done so far has addressed the easy-to-reach populations, and water and sanitation will increase in cost as you reach more remote communities, perhaps some of the more difficult communities to address. So, yeah, as a note of caution, but I'd also like to hear whether you think your model can be adjusted, perhaps to talk about the value for money side, not just the cost-effective side.
Yeah, thank you. Obviously, this is just can ever only be a proxy measure, and one should supplement this with common sense. And I would not advocate that we stop doing all polio eradication and guinea worm eradication because that would be mad. Just because there are very few cases and we spend now millions on finding the last cases. Obviously, this is needed. One could correct for that in the models by just making an estimate of like how many future cases one would avert. Then what we're really focusing on is also what are the uncrowded areas where your marginal dollar really makes a counterfactual impact. So obviously immunization would be much more effective, but if Gavi is already like very well funded, then maybe we go to the next thing that is not as well funded. And this is also the case, I think, with disease eradication, which philanthropists are very gung-ho to do this because they want to find the last guinea worm. So if Jimmy Carter and Bill Gates are already doing the disease eradication, then we don't have to. So we can take this into account, but obviously would have to come up with more models. So this is a very crude proxy for what we could focus on, but there might be a case to be made to focus on disease eradication, and malaria eradication is similarly important, and handing out insecticide-treated bed nets is plays a significant role in that too. So I hope that answers your question.
Yes. Yeah. But the blue tie, gentleman with the blue tie.
I was just very interested on the same theme of the lack of reliable data on the wash sector. Presumably, it is it's generally thought, I just read the literature sometimes, that it's the number of variables. So you've got to get both hand washing and toilets and food preparation and safe water, and the illness is sometimes variable. You get cholera outbreaks and this outbreak and typhoid outbreaks. And also, it's almost impossible to get a placebo. Like with water, you can't say this water looks as good, but it's dirty, because it looks dirty, and if it's clean, and people exaggerate their results. So just because it's difficult, because it's important, doesn't necessarily mean we should downgrade it as a solution. It's not ineffective, it's just difficult to actually prove it's effective. Thank you.
Thank you. Could you pass the mic back to the gentleman with the blue tie?
Just
a second. Yeah. We'll try and accumulate a few different points and we'll do them together.
Thank you, Mr. Chairman. First of all, I'd like to commend Martina on what is a truly innovative initiative. In the literature, I've seen the costs of the bags to the communities quoted, what I'm interested in is how close to the cost of production of the bags are you able to bring parity between the cost of sale of the bags and the cost of production, especially obviously with the potential cost hikes of urea in the future.
Okay, well, could Mr. Hililebrandt, do you want to go first on the previous point?
So yeah, absolutely. I realize that wash interventions are much more difficult to measure. For instance, self-reported diarrhea, that's an issue, and the interventions are much more sophisticated, so they're not as easy to measure as mass drug administration for parasitic worms. But it's not impossible. So I think you can measure chlorine in water, and there the trials are not very good, and you can look at reduction in schistosomiasis through water interventions. There's no reason why the people who do mass drug administration can do this, but the water intervention people cannot. And so as I've shown, there's not much out there in terms of cluster randomized control trials, and they would be easy to perform.
So the wash people just haven't done their job, more or less.
Yeah, maybe. Yeah.
Martina, do you want to do it?
Yes, thank you. Before I comment on production costs, I would like to highlight that the business model is much more complex than just comparing production costs to what the consumers are buying the toilet for in the slum. Since the toilet is basically sold twice, first as a toilet, but then as a fertilizer. The income of the fertilizers is also expected to support bringing down the price of the toilet to the consumers. And this model, of course, looks different in different parts of the world because it depends on what community you enter and it depends on their purchasing power as a toilet consumer, but also then as a fertilizer consumer. So, having said that, as of today, we have 2 community programs, one in Kibera slum and one in the slum in Goma in DRC. And in Kenya, that program has been running since 2010. However, the certification with the Kenyan government of the fertilizer product is not yet finished, so we're not able to yet sell the fertilizer commercially, meaning that we do not have the income from the fertilizer as of today. In Congo, the authorities and governmental processes are not as strict and it goes a bit quicker, but that project only just started last year, so we don't really know yet how much we will be able, or the implementing organization in Goma is Caritas, so we don't know yet how much they will be able to sell the fertilizer for. So I don't know, is my answer. I don't know if we will be able to come down in production cost enough for these models in the communities to be financially sustainable, because we don't know the actual monetary value of the fertilizer in these communities as of today. And when we've reached that level in these communities, when we move into the next community, we will have to explore it again in that country, in that market. So this will be sort of an ongoing process in every new country we enter, looking at the purchasing power for the toilet and the purchasing power of the fertilizer, and then compare it to the production costs we are on at the moment. And obviously with our product, we have urea and we have biopolymer. And the market of the biopolymer is still quite a new market, and there's lots of things happening when it comes to biomaterials, bioplastics. And only during the last 5 years, we've seen lots of new materials coming out on the market, lots of new blends, and obviously we have quite high demands on our material, but we also hope that we will be able to come down in material cost, because the material of the bioplastic is today what is the most expensive part of the production.
Thank you. Lady in the middle.
Lisa Campos from University College London. My question is for Petra. Thank you very much. My question is for Petra regarding to the system. Very interesting. And we know that solar radiation is just work for a certain period, and if the water is again put in the dark, the microorganisms will redevelop. So my question is, if you have look at aspects of storage, how people are storing their water, and also if you have considered the combination of using a simple sand filtration, household sand filtration, before using your irradiation system. Thank you.
Before we pass the word back to Mrs. Wadstrom, are there any questions about the urbanisation points that was made? You had one more. Okay, one more.
About the Solvatten system.
Yes, go ahead.
My question is, my name is Martina Nee, I'm from Holland. My question is, what is the cost of the system itself? And are people in these small-scale villages able to buy it themselves? Or do you always need donors to take care of systems and sending them out in the fields?
Petra?
Okay, yeah. Thank you. I want to try to answer your questions. And I think the size of Solvatten, it's a 10 liters unit, and the size of a storage container is something that we always recommend to have a size that fits to Solvatten. So it's not too big, it's for a household. It should be used as we use water. If it's old water, next day it's good to do the process again. So it's about common knowledge to teach also the users. But we have looked into the safety of Solvatten after 4 days of storage in dark, and we haven't found any microorganisms growing into the. So and then your second question was with the sand filter, and for us we have always been introducing local ways of, for example, using a sand filter. So we have instructions in our training manuals how to make that, and it's also very easy to make from a PET bottle upside down, and you can make a filter directly on Solvatten, put some cloth and some sand. But we have a small filter that reduces the turbidity. So it's from 30 NTU now without filter. All those tests were done without the filter. We know the filter is taking out about 35% of reducing the turbidity. But I think it's important to teach all the challenges around the water. So we have a nice, good inspirational training manual that is. And then your question about price, and we have a price of Solvatten. Now I'm not good in Swedish. It's about 800 kronor from the factory. 800 kronor is about how much in pound? It's about $85 something. Yeah, or not really so much. But and then it's at least 7 years of use without changing parts of filters or any additional parts. So we see the use per liter. We produce we have Kenya as a reference project, Western Province, about 6,000 liters per year. And with 7 years, you have about 40,000 liters of safe and warm water. So per liter, if you look at per liter and life cycle costs, so it's very, very low, much lower than if you look at the kilowatt, it's about 400 kilowatt a year. And if you have it for a couple of years, it's quite a lot of cost just for the hot water. And I don't know if it was another question about price, or you.
I think if there are more detailed questions, you'll have a chance during the course of the day to put them to the speakers if you catch them in the coffee break and so on. If there are no other questions on the urbanisation issue, I think
somebody
yeah.
had a hand up.
Yeah, I know there are several, but unfortunately we have to. We're running quite a long way behind schedule, so I think we need to make up some time. But people can talk in the coffee break. Timeyin, you had a point to make. I'll give you the last word because you didn't get any questions.
Thank you, Sandy. That's very kind of you. I just wanted to come back to the question of the research by Hauke. I appreciate the evidence of effectiveness and issues of that nature, but it sounds to me like your analysis is a cause and effect question. You are addressing diseases, you're treating diseases, and you're leaving out the symptoms. So if you give drugs or you apply mosquito nets to a bed, you've not eliminated the mosquito is still in your community. But improved environmental sanitation takes away the mosquito without killing even the insect. So you can't measure that. And so the implication of putting out these kinds of information is that all the efforts that everybody in the world have spent 15 or so years trying to get governments to come together to approve water and sanitation as a central goal will be lost. We've been involved in debates and campaigns with African governments, African ministers of finance. To get them to even sit with water ministers was a big struggle. Any minister that sees this kind of information will just throw out the arguments for water and sanitation. I think it would be very unfair on the poor people who are dying to delink, Sandy is quite good with, Val, on this question of the four channels to hygiene, flies, and I can't remember it. I'm not a behavioral change person, but it's like cutting that link and focusing on the diarrhea itself, or the schistosomiasis, or the river blindness, and forgetting that all of this comes because people don't have water, they have poor sanitation, they don't wash their hands. We just cut all of that out and say it costs only $3, but this costs $50. I think it's a shame.
If I can just add a final point before we finish, I think it's important to realize that water and sanitation have multiple outcomes. Health is only one of the benefits. There's saving in time and labor by women and a whole lot of other benefits, which are of equal or sometimes even greater value than the health benefits, so that it's important to partition them. And the original study in disease control priorities did do that, and if I remember right, they came out with greater cost effectiveness when you do that, because some of the cost is borne by other ministries than the health ministry. So it's a complex issue, and we need to keep on thinking about it. But thank you very much, everybody. I think it's the coffee break now, and we've managed to make up no minutes, but we haven't lost any. Thank you.